Welcome to a college nursing education simulation using a hospital in the virtual world of Second Life. My name is John Miller. I'm a registered nurse and nursing faculty at Tacoma Community College, Tacoma Colleges of Washington State. The hospital on the left and the orientation area on the right that you see is built by a company called Movers that creates educational simulations. Up in the sky up above are floating islands, and on each of these islands are interactive objects that I've created, pretty simple ones, for students to reinforce some of their pathophysiology as well as disease process and interventions. So let's go ahead and fly over to this is my avatar. I'm operating right now using my keyboard. I'm going to walk into the medical area. And we'll go in, and as we enter the room, we'll go ahead and wash my hands. We'll go over here and start the sim. We'll connect up the monitor. And there you can see a basic representation of an ECG, temperature, pulse respirations, blood pressure, and pulse oximetry. So let's go ahead and talk with the patient. Of course, we first already looked at the patient information, patient info, which is appearing in the gray box to your left. And there's more information as you scroll down. We can also look at the medical orders. We see orders for aspirin, nitroglycerin, normal saline. If we scroll down, we'd see some lab orders also. So let's go ahead and talk with the patient. So I'm typing right now in the chat line. The patient says, "My chest hurts." And I'm going to ask the patient if they can rate the pain. And he rates the pain as a 7. We can ask him other questions also. So let's go ahead and attach the oxygen. So we'll zoom in on it. We'll connect the oxygen. Let's set the liter flow, maybe 4 liters. And if we look in the chat line at the bottom, you'll see the oxygen was set at 4 liters. So everything's recorded in the simulation in chat for the student or instructor to look at. Let's go ahead and start an IV. Get some gloves on. There, I've got my blue gloves on. And we'll go ahead and go to the medication dispenser to get some saline out. Normal saline. A bag of it. And we'll go ahead and transfer the bag up to the IV stand, and there you see the bag appears. And then we'll set the rate at 75, which was ordered. And I almost forgot to connect the IV. So again, in chat you would see the IV rate set as well as the solution. Let's go ahead and give some pain medication. We'll go back to the medication dispenser. And we'll assume I already gave the patient aspirin for him to chew, but I'm going to now go ahead and give him some nitroglycerin. And we'll look up on the blood pressure. Blood pressure is 146/84, so I'm going to go ahead and give him some nitroglycerin by clicking on his hand. Then I'll give the nitroglycerin to the patient. And if you look in the chat line, the nitroglycerin 0.4 milligrams has been given. And if we wait a few minutes, we're going to see the blood pressure actually drop down. Here we see the blood pressure has dropped somewhat from the nitroglycerin, despite giving the patient 3 nitro. The chest pain is now rated higher, heart rate's up, blood pressure's up. So we're going to go ahead and give some morphine. Patient has suddenly gone into ventricular fibrillation, so we're going to call a code and get some help. I'm going to start CPR, so here comes another nurse in. Start CPR. And the other nurse is ambuing the patient. And we're going to go ahead and get the defibrillator ready. And go ahead and set the joules to 200. Go over to the patient. Have everybody stand clear. And deliver the shock. And the patient goes back into sinus rhythm. We interact with other cultures, nationalities, and languages, as well as people from numerous real-life health support groups. And of course, students can collaborate with other medical professionals and educators. What you saw in this video is a patient being asked questions by the nurse, receiving oxygen and IV line, medications, and defibrillation. Much more simulation is possible using Second Life.